Are you all right? Are you all right? Hey, I need some help in here. She's coding. She's coding. I can help. You want to start some questions? Yeah. Can you put her on the monitor? Okay, looks like she's on a course view fib. We're going to need a defibrillator as soon as you get her on the monitor.
Okay, monitor on. Getting ready to charge. Charging.
Charging at 200.
Sound back. All free. Chuck.
Bing.
Okay, let's give her out of epi. 1 epi going in.
1 milligram of epi.
Continue CPR. I'll do the charting. Patient intubated.
Patient
Tube
is
in.
in.
Hey, whoa, wait, stop reading into my mom. My mom had an advance directive. She didn't want CPR.
Don't let this happen to you or your family member. An advance directive, also known as a living will, is a document that includes the written personal medical treatment preferences and a designated surrogate decision maker in the event that a person is unable to make their own medical decisions.
When you give your healthcare provider your advance directive, they take it and they put it on your chart. For those with electronic charting, they'll scan it in. And there it will remain. Whether it's looked at or not depends on your healthcare provider and whether you have the conversation with them. Make sure you have that conversation with them. Hello, my name is Susan Becker, and I've been a nurse for 30 years, most of that time in ICU. For the past 5 years, I've been a clinical nurse specialist in critical care. I'm standing on the steps of the Capitol building in Washington, D.C. This is where the 1990 Patient Self-Determination Act was passed. According to this federal law, healthcare professionals must ask on admission if you have an advance directive, a document that states your medical wishes. If you do not have an advance directive, then information must be provided on how to write one. If you have an advance directive, I congratulate you, for you have taken the step to write down what prolonged life-sustaining measures you want and done, and then actually written them down. Unfortunately, the law doesn't state that the healthcare providers have to review this with you or discuss what happens to you if your heart were to stop. Most staff will automatically provide cardiopulmonary resuscitation or CPR for patients, since all patients are assumed to want CPR unless ordered by the physician to be withheld. CPR is a wonderful method to revive patients, but is not always appropriate to initiate. Those patients that have an end-of-life chronic illness, multiple organs failing, severe dementia, or remain in a persistent vegetative state may not wish to have heroic measures administered to them. Expressing the wish to not have CPR does not mean that all treatments would be withheld. No CPR only means withdrawing CPR, not blood products, medications, including antibiotics, will all be administered to promote your health. But not following the patient's wishes, there is the possibility of increasing the pain and suffering of patients, causing anguish to the family and moral distress to the nurses, plus accrues unnecessary costs.
Ideally, the Patient Self-Determination Act needs to be amended to stipulate that all acute healthcare institutions on admission must provide documentation of the content of conversations with patients and their families regarding advance directives. As a healthcare consumer, this is legislation that you need to support to protect your rights and privilege to determine your own medical treatments.
Until then, you need to be your own and your patient and your family's advocate. Speak up when you are admitted to a healthcare facility, and tell the physician and nurses to stipulate you do not want CPR performed if your heart were to stop. When it is no longer possible to prevent death, the goal in healthcare is to give comfort and limit pain. Advocating for your desires to be recognized allows for you to be in control of what medical treatments are being done to your body. Requesting CPR not to be administered is your right. Hi, welcome to Washington, D.C. Where are you from?
New Jersey.
Do you have an advance directive?
Yes, we do.
Very good, I congratulate you. Now, have you been in the hospital recently, admitted as a patient?
Yes, I have.
When you were admitted, did they ask you for a copy of your advance directive?
No, they didn't.
They didn't. Did they also ask you if you wanted CPR done to you if your heart were to stop?
No, we had no discussion.
Well, thank you very much, and know in the future, though, that you should have that discussion with your physician or your nurse.
Well, thank you very much for informing me.
And have a good day.
Thank you.
So where are you from?
Virginia?
And have you or a family member ever been admitted to a hospital?
Yes, we have.
Okay. And when
My wife has.
your wife, okay. When she was admitted, did they ask for her advance directive?
I don't recall. I don't think so. I would have remembered that.
And did they also have a conversation with you about CPR, whether if her heart were to stop, if she wanted that?
Maybe with my wife, but not with me. I don't remember them, giving me that. It's been a while back anyway, but I don't recall that either.
Okay. And, well, in the future, if you or your wife are ever admitted to the hospital, you should, if you want to have that conversation, you should really make sure that you have it with your health care
I'll look for
professional.
it now.
All right. Well, you have a good day. Thank you.
I thank you.